Before we begin, we ask that you please turn off your cell phones and other electronic devices. Please remain seated while the class of 2026 enters the auditorium. Good afternoon. Good afternoon. There we go. My name is Jeffrey Putman, and I am the Vice President for Academic and Student Affairs. It is my pleasure to welcome you to the 27th Annual White Coat Ceremony. Our ceremony today is proudly sponsored by the College of Medicine, and we want to especially thank the Alumni Association of the College of Medicine, and especially Dr. James Ferguson, class of 1981, and his wife, Mrs. Irene Ferguson, for not only their generous donation in support of this important event, but for purchasing the first white coats for the class of 2026. We would also like to thank the Arnold P. Gold Foundation for providing the Humanism in Medicine pin for each of the members of the class. The White Coat Ceremony is a relatively recent innovation. Dr. Arnold Gold, a neurologist on the faculty of Columbia University's College of Physicians and Surgeons, started the White Coat Ceremony tradition in 1994. Dr. Gold thought that an appropriate oath, which represents the humanism of medicine, should be taken at the beginning of medical school as well as at commencement. The White Coat Ceremony serves to welcome students to the practice of healthcare and elevate the value of humanism as the core of healthcare. It provides a powerful emphasis on compassion in combination with scientific excellence. Dr. Gold was concerned that physicians were becoming more enamored with the technological aspects of medicine rather than listening to and caring for patients. The most important element of the ceremony is the oath that students take in front of their family, school leadership, and their peers, and with their faculty, to acknowledge their central obligation to caring for the patient. In 1995, the Gold Foundation expanded their sponsorship of the White Coat Ceremony to 7 medical schools, including SUNY Downstate's College of Medicine, and we have held this ceremony ever since. The Gold Foundation reports that the White Coat Ceremony takes place at over 99% of schools of medicine in the United States and Canada, as well as at osteopathic schools of medicine and at medical schools in over 19 other countries. We are also proud at Downstate that we helped begin a new tradition by expanding our White Coat Ceremony to the College of Nursing, as well as our physician assistant and physical therapy programs. We are grateful and honored to have been one of the earliest institutions to partner with the Gold Foundation. And as an example of the dedication to the mission of keeping healthcare human, our next speaker, our own president, Dr. Wayne J. Riley, is a trustee of the Gold Foundation. To bring greetings to the class of 2026 and our guests, I would like to introduce our next speaker, the 17th president of the State University of New York, Downstate Health Sciences University, Dr. Wayne J. Riley.
Well, good afternoon, class of 2026. What a great day in September it is, this beautiful Friday afternoon. And it's more beautiful because of what is about to happen to each of you. And that is that it's a time-honored tradition over the last 20 to 30 years, to recognize the beginning of your medical education by this ceremony. And, you know, medicine is full of symbols and ceremony. And this one is very special. And as I tell folks all the time, there are 4 days in my life, well, to my 2 children, my wife, okay, 7. Thank God she's not here. She's a physician too. But the 4 days in my professional life that I never forget are as follows. The day, well, in my era, we got a letter saying, hey, congratulations, you've been offered admission to blank blank medical school. In your case, you got an email, right? So that day, you probably never forgot the time, hour when you open that email and say, congratulations, you've been admitted, right? That's one day. The second day is today. The White Coat Ceremony is one, because it's before your friends, families, significant others, partners, spouses, children, grandparents, cousins, play cousins, all that. They're here to support you because they have been by your side on this gauntlet that we all have to get through to become a physician. Next is going to be graduation day in 4 short years, class. It goes amazingly fast. Even though Unit 1 may not feel like it's moving, I can assure you the rest of the units are going to fly. And in 4 short years, you are going to walk across the stage and become an MD. And another one that I'll never forget is my first day as a real doctor, as an intern in Houston, Texas. First day on duty, I think I was on a 12 to 12 shift. And I walked into the emergency room, and it was just chaos. And I remember a nurse saying, "Doctor, get over here." And I did this. You, Riley, get over here. But yes, colleagues, these are the days that are very special. And the specialness of the white coat, it makes you feel differently when you put it on as a physician. It's a constant reminder when you wear it that we are so privileged to be physicians, to be among the most admired professions in the world. And that white coat comes with responsibility to care deeply about your patients, care deeply about your colleagues, care deeply about your community, and I would say care more deeply about the world. So on behalf of all of us who are privileged to be here at Downstate as your faculty, congratulations, cherish this day, and continue to live up to the ideals reflected in the wearing of the white coat. Thank you.
It is now my pleasure to introduce Dr. F. Charles Brunicardi, Senior Vice President and Dean of the College of Medicine.
Thank you, Dr. Putman. Good afternoon and welcome members of the class of 2026, your families, significant others, and friends, as well as the Downstate administration, faculty, and staff to our 27th White Coat Ceremony. You are entering the College of Medicine at a time of great stress, as our nation and indeed the world continue to be impacted by the pandemic, the worst medical crisis of our lifetime, which struck us all over 2.5 years ago, and we're still living with it. The world has dramatically changed, and the profession that you are starting on now, healthcare, is at the heart of this new landscape. Most importantly, you can look forward to an era of extraordinary and exciting medical discoveries and technological advances. In fact, there have been more scientific and technological advances in the past 50 years than in the entire history of the world. These advances will greatly enhance your ability to alleviate human suffering, and at the same time, you can expect to encounter a host of new medical and ethical dilemmas as we see every day in the news. Our faculty will do their very best to prepare you to meet those challenges. We have a long tradition of training physicians who are skilled not only in treating the diseases, but also the humanity of the person. And for this reason, we celebrate the start of your medical education and career by giving each one of you a white coat, one of the symbols of a physician's compassionate care. It is a profound truism that the best patient care is caring about your patients. The white coat is also a way for us to welcome you as junior members of our profession. Now, I'm so excited to introduce our white coat speaker this year. So in teaching leadership, one of the most important principles of leadership is having a vision. So right now, your vision is to get your MD degree, but I'm going to challenge you today and think about what disease you want to treat and how you will cure it. And there's no greater example of that than our white coat speaker today, Dr. John Bukvar, who graduated SUNY in 1997. Dr. Bukvar currently serves as the Vice Chair of the Department of Neurosurgery at Lenox Hill Hospital and Director of the department's Brain Tumor Center, the Pituitary Neuroendocrine Center, and the New York Head and Neck Institute at Lenox Hill, and the Manhattan Eye, Ear, and Throat Hospitals. Woo! Dr. Bukvar is a professor of neurological surgery and otolaryngology, as well as head and neck surgery at the Zucker School of Medicine at Hofstra Northwell. He's also an investigator at the Feinstein Institutes for Medical Research, where he directs the laboratory for brain tumor biology and therapy. Therefore, he's a surgeon scientist. Most recently, Dr. Bukvar was appointed as a visiting professor at the legendary Cold Spring Harbor Laboratory, making great advancements in understanding and treating brain cancer. Now, Dr. Bukvar is internationally renowned for his surgical expertise and for providing patients with safe, effective, and minimally invasive care for brain tumors, skull-based disorders, and disorders of the spine. His surgical expertise is in benign and malignant brain tumors, as well as skull and base and endoscopic pituitary surgery, spinal and peripheral nerve tumors, minimally invasive spinal surgery, and complex spinal disorders. What an incredible accomplishment. Dr. Bukvar has been recognized for his novel research in brain tumors and stem cell biology, trying to determine better ways to treat these terrible cancers, and has been named to multiple Best Doctor lists. His research has been widely published, and he has received numerous national awards, including the Eric Lichtenstein Humanitarian Award from Voices Against Brain Cancer for his compassionate work in treating patients with brain cancer. In 2016, Dr. Bukvar was elected to the prestigious Academy of Neurological Sciences, and the following year was elected to the Senior Society of the American Board of Neurological Surgery. So we congratulate you, Dr. Bukvar, on your outstanding achievements. Especially, we're so proud of you having graduated Downstate and gone on to be a preeminent neurologic surgeon and scientist. And we believe that your stellar career and words of advice will inspire our audience, especially the class of 2026. Dr. Bukvar.
Thank you so much, Dean Bernicardi. Thank you, Dean Cristoforo, who I don't see anymore. Thank you, President Riley, and of course, Dr. Putman as well. And thank you to all of you, friends and family, for embarking on this great ordeal/journey. You're in for such a treat. You're in for such a treat. Every single day when I look in the mirror, I say, I'm in for such a treat, and you really, really are. I bleed Brooklyn blood, and I bleed Downstate blood, and I'm going to tell you a little bit about why I say that, and why I think it's important and how it's molded me. I'm very fortunate to have a family of physicians, and I never, one day in my life, I'm not grateful for that. My great-grandfather in 1903 came to Brooklyn and studied ophthalmology and built a practice here on Grand Army Plaza. My grandfather followed in his footsteps, also in ophthalmology, took his Long Island College Hospital medical degree, which, as you know, predated the name Downstate, and also practiced ophthalmology here in Brooklyn. My father, not long after the Brooklyn Dodgers left to go to LA, took his Downstate degree and also became an ophthalmologist. So you can imagine on my personal statement to neurosurgery, what was my final line? I see things differently. My history. What's interesting is the wards at Kings County changed over time. So in my grandfather's ward, it was a Tay-Sachs ward. In my father's time, it was a tuberculosis ward. In my time, it was an HIV ward. So as Dean Bernicardi said, think about what ward you're going to be treating. Obviously, you all treated we all treated COVID wards this last 2 years. So really, the history of medicine remains a passion of mine. And I want to just tell you about one quote that really inspires me, and I want to inspire you. Only the person who is familiar with the art and science of the past is competent to aid in its progress in the future. That was from a general surgeon, Bill Roth. And the point of that statement is, as Hamza, who is a medical student here and was my research fellow, can attest to, everything we do in research is predicated on our understanding of the successes and failures of our predecessors, our mentors, and people before us. So study the history of medicine. It's actually important. The ideas that I got from my clinical trials came from the 80s and 90s as I was researching the disease of glioblastoma. If medicine matters. I want to talk to you about burnout a little bit. I know that's not an optimistic conversation, but I think it's a realistic conversation. And burnout is a problem that I want you to be aware of, but I'm going to introduce you to some of the techniques that I use. I only have you for 10 minutes, so I might as well use it. I'm going to teach you a little bit about some of the techniques I want you to think about as you approach the beginning of your medical school career and then what you're going to become. So a recent paper in JAMA came out in 2020, interestingly, in February of 2020, which, as you know, is the month before the pandemic hit. And it was a questionnaire to retiring surgeons, what they would do differently in their career. The number one thing they said is, I wish I spent more time with family and on personal wellness. This is before the pandemic, right? So you can imagine that the retiring surgeons all said, I wish I could have spent more time with my family and on personal wellness. So I'm going to tell you, it is possible to have a healthy work-life balance, but I'm going to make you do one thing first. Switch those terms. It is possible to have a healthy life-work balance. I have 4 kids. I've been married for 23 years. I'm a busy neurosurgeon, but I have a very healthy life-work balance. But you must start by practicing time management. Manage your time well, and I'm going to tell you a little bit about why not to scroll on TikTok. There are 3, we were talking about books that I think are important, 3 of them, Grit, Flow, and Full Catastrophe Living, okay, and I'm going to tell you why. Grit is a book by Angela Duckworth. She was from Penn in the Department of Psychology. She wrote Grit. Now, all of us have grit, or else we wouldn't be in this auditorium. Grit is not just grit, as you think it is. It's actually the deliberate practice to achieve peak performance. And one of the key aspects of grit that I want you to introduce you to is mentorship and feedback. So you are blessed to be at an institution full of mentors. Downstate trains more physicians in New York State than any other medical school, I think in perhaps the entire country. There are mentors that wear the Downstate badge on their coat, right and left. Hamza, my fellow, is one example of how he found his mentor. I hope to be your mentor. And I encourage you to use this deliberate practice, get mentorship, get feedback, and you will reach peak performance. Does anybody know, by the way, this is somewhat of a non sequitur, what the world record holder for the digits of pi is? 3.14 or something, something, something. The record holder is 75,000 digits of pi. It takes him 17 hours to recite those 75,000 digits. I know it sounds ridiculous, but with deliberate practice, the mind is able to do incredible things. He was able to learn from the previous record holder how to memorize long strings of digits, and that's how world records are broken. So you can practice, and during medical school, guess what? You have to practice, you have to get mentorship, and you have to get feedback. Number 2 book is a book called Flow. The flow state is a very important state of the human brain that allows you to reduce the amount of anxiety and depression. So there's an area of the brain called the default mode network that if you activate it, guess what activates it? TikTok, scrolling, fantasy football, those kind of things. You want to minimize the DMN. And the flow state is actually a place where we've all been when we're running and the run seems effortless. And so deliberate practice allows us to achieve peak performance and enter the flow state. Michael Jordan used to talk about dropping 63 points in a quarter at Madison Square Garden. He would talk about how the ball was going through the net before he released it. That's flow. That reduces anxiety and depression. That is achieved with a deliberate practice, and that it reduces burnout. The final concept that I want you to think about is from a book called Full Catastrophe Living by Jon Kabat-Zinn. Jon Kabat-Zinn is the grandfather of American mindfulness. Mindfulness is an extremely important stress-reducing technique I want to introduce you to. As you enter medicine, which you're doing now, you're going to need some stress-reducing techniques. So I find a time in my day, about 6 minutes on the subway from Harlem to 77th Street, I practice mindfulness. It's actually just a dedication to being in the present moment. It's simple breathing techniques. I always say I carry 3 things with me every day: my wallet, my phone, and my breathing. The first 2 cause me enormous stress, and the last one gets me out of it. So I want to encourage you, and again, the book is called Full Catastrophe Living. It's a terrific book, and I think you guys would all benefit from understanding that. One of the important things I just want to remind you is something called beginner's mind. Beginner's mind is seeing the world as if you're a child, and you're seeing things for the first time. Some of our most important serendipitous discoveries in medicine was just having an open mind. Penicillin was by accident. Cisplatin, the most common chemotherapy administered, was by accident. So beginner's mind is approaching things as if you're a child, seeing things for the first time. Serendipity favors the beginner's mind. In fact, Louis Pasteur said, chance favors the prepared mind. So I want you to balance that and understand that serendipity will be an important factor in your life. Perhaps you'll be Robert Fritchcott and discover nitric oxide. So keep an open mind and things will go your way. I've talked about history of medicine. I've talked about grit, talked about flow, I've talked about mindfulness. Why are you here today? We're going to talk about empathy and compassion, and then I'll wrap up. Voltaire's, my favorite quote from Voltaire, it's the only quote I know from Voltaire, is the art of medicine is amusing the patient while nature cures the disease. The art of medicine is amusing the patient while nature cures the disease. In medicine, we say doctors are described as having 3 A's: availability, affability, and ability. 3 A's of being a physician: availability, affability, and ability. Now, contrary to what you may be thinking, in my opinion, availability is the most important thing to your patient. So I have learned both from my ancestors and from my colleagues and from my downstate mentors, being there for your patients is the single thing that they need most, particularly now when many of our patient populations feel abandoned. And likely, you're going to be holding their hand as, yes, you will be providing some therapies, but majority of the time, you will be amusing them as you and nature cure their disease. So give them your email. I give my patients my cell phone, and it is an extremely important point. Okay, so look around you. You have friends, family, colleagues, and of course, this great faculty here at Downstate. Admiral William McRaven said, if you want to change the world, find someone to help you paddle. And every single person in here is in your boat. So look around, be grateful, and start to paddle. I'm going to end with one of my favorite Buddha quotes. What you think you become, what you feel you attract, what you imagine you create. So go out there, think, become, feel, attract, imagine, and create. And best of luck to you guys. Thank you.
And now I'm delighted to present the class of 2026. Will the following faculty members please come forward and take your places? Dr. Riccardo Bianchi, Associate Dean for Foundations of Medicine, will be assisted by Sophie Cristoforu, Associate Dean for Student Curricular Affairs, in reading the names of the members of the class of 2026. Dr. Christina Guillen, Assistant Professor of Pediatrics, Dr. Seth Langley, Assistant Vice President for Academic Affairs, Dr. Christopher Roman, Interim Chair and Associate Professor of Cell Biology, and Dr. Raj Wagankar, Associate Professor of Medicine and Cell Biology, will assist with directing students to the stage to obtain their white coats. And Dr. Sidney Butts, who is the Interim Chair and Associate Professor of Otolaryngology, and Dr. Stephen Wadowski, who is the Chair and Professor, Department of Pediatrics, will assist us by coding the members of the class of 2026. Dr. Bianchi.
Thank you, Dr. Puckman. Good afternoon, everyone. I will be calling the students one by one for the coding. So when I call you, please, from this place, advance to under the stage for the coding, and then proceed to the far end and out for the picture, and come back the same way that you came in at the beginning. So the first student, Shahrukh Abduloye. Thank you. Paris Aquaro. Noreen Ahmed. Iram Ajmal. Saad Ahmed. Shannon Alexander. Matthew Antonellis. Kajatu Ba. Alberto Bierentos. Viknesh Bhaskar. Kayla Boyer. Anna Brown. Anastasia Bowie. Roshani Cameron. Kevin Carfley. Christian Castar. Shirley Chen. Justin Choi. Is that? Justin Choi? Yes. Okay. Sawania Crystalline. Janelle Kokorpus. Benjamin Devilman. Divya Dayal. Izima Dennis. Joanna Dionering. Daniela Diaz. Uzaifa Doria. Jordan Aidless. Rahat Hilani. Mia Ermolenko. Maria Farag. Julia Fisher. Jack Flanagan. Dario Fusic. Madeline Fudala. Sasha Gerard. Gina Joya. Joseph Goldblatt. Nikita Gupta. Ivana Halaka. Yusuf Hassan. Matthew Hyder. Crystal Hernandez. Pemia Jaktiani. James Kessler. Amber Kamlani. Alana Cautious. Vani Kumar. Max Kushter. Alex Lapoche. Michelle Liu. Amanda Lopez. Christopher Magloire. Samir Mahmood. Katie Mania. Stephanie Manis. Leanne Marcello. Izana Mesfin. Brittany Moncrief. Harris Nedelman. God's Time Watu Ugwu. Okay, sorry. Ugwu was the next one? Okay. Ugum Sidnachi Wabani. Hunania Oj. Favor Ononogbu Uche. Jasmine Pack. Susan Paraga. Musa Painke. Paula Pedrani. Rachel Phillip. Laerta Pristina. Asta Kaba. Benjamin Prizer. Juan Ramirez Correa. Gitanjali Reddy. Jessica Richman. Yanilka Rodriguez. Morgan Rotar. Alejandra Ruiz. Nicholas Rutig. Asma Sadia. Polina Safovich. Shalandra Samuels. Kelsha Sanchez. Annalena Sanfelici. Leah Sarmiento. Olia Schultz. David Shifton. Alfred Shim. Joshua Singavarapu. Rachel Skelton. Kyle Smith. Michelle Salsov. Owen Storms. Jui Thomas. Surya Thomas. Rafat Uddin. Nikki Owagiran. Kelly Virasamy. Kiana Fomeidel. Julius Wu. Emily Yang. Jessica Havner. Izoza Yunusova. Michelle Zhu. Elise Zickelbauer.
While we wait for them to get their pictures taken. Yes, a round of applause. Yes, thank you. While we wait a couple of minutes for them to finish getting their pictures taken, we have a short slideshow from the Class of 2026 orientation program.
It might seem crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Bring me down, can't none bring me down. The love is too high. Bring me down, can't none bring me down. I said, bring me down, can't none bring me down. The love is too high. Bring me down, can't none bring me down. I said, clap along if you feel like a room without a roof. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Bring me down, can't none bring me down. The love is too high. Bring me down, can't none bring me down. I said, clap along if you feel like a room without a roof. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Hey, hey, hey. Clap along if you feel like that's what you want to do. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Hey, hey. Clap along if you feel like that's what you want to do. Come on.
Congratulations to the Class of 2026. Now they're all back. It is tradition at SUNY Downstate Health Sciences University to present the oath for teachers and learners at SUNY Downstate Health Sciences University, which is located on the back of your program. It is my great pleasure to once again introduce the 17th president of SUNY Downstate, Dr. Wayne J. Riley.
Congratulations again, class of 2026. I'll add a personal note before we proceed with the oath. But I want to say that we are eternally grateful that you chose to study here at SUNY Downstate Health Sciences University, to pursue your dream to become a physician. Now, as president, these words are spoken truly from the heart, class, because sometimes we don't say that enough. But I realize, and many of us also who work and teach here know that if there were no you, there would be no us. So thank you sincerely for bringing your special brand of joy, your unique and diverse experiences and backgrounds, and your excitement for the humanistic practice of medicine to Downstate. Now, as part of your orientation to Downstate, your faculty have talked to you about the social contract that those of us in the medical profession have with our patients and with society. In 4 short years, when you graduate from SUNY Downstate, you'll be granted your MD degree and recite the Hippocratic Oath. The Hippocratic Oath is a time-honored reflection of the professional values and behavior that physicians commit to as part of that social contract. So today, class of 2026, we ask you, our new students, to join with our faculty in reciting an oath meant to be an explicit commitment to the ideals that we promise to uphold as part of that social contract and to each other, as faculty and as students, and more importantly, as members of this great community. While professionalism requires more than a vow to good intentions, these vows define our responsibilities and obligations as future members of the medical profession and as SUNY Downstate medical students. So would all members of our great faculty present today please stand? Now, members of the class, will you rise? I now ask that you read the oath printed on the back of your program and which also appears on the screen behind me, following the prompts. So when it says students, the students will read along with me. And when it says faculty, I will ask my colleagues to read along with me as well. We pledge to serve our patients, their families, our community, and each other with respect, integrity, competence, compassion, humility, and humanity. We hold as our ideal the care and treatment of all patients. From them we will learn. We hold as our ideal the advancement of knowledge. Through it, disease will be understood, prevented, and cured. We hold as our ideal open-minded collaboration. To this we are collectively committed. We hold as our ideal critical self-evaluation. Through this we will grow. We, your faculty, promise to serve as worthy role models as our own teachers have before us. We, your students, recognize the expertise and commitment of those whom we learn. We promise to support your personal and professional growth in the clinic, in the laboratory, in the community, and in your own teaching. We promise to pursue responsibly in our calling to patient care, to service, and to research. We promise to maintain an environment where scientific integrity and ethical standards sustain your trust in us. We commit ourselves to the highest standards of academic honesty, scientific integrity, and ethical practice as both students and in our professional lives. We honor and embrace the SUNY Downstate Health Sciences University College of Medicine history and commitment to service to the people of Borough, Brooklyn, the city of New York, our nation, and the global community. We support its rich tradition of teaching and research excellence. We accept the challenges and opportunities of those alumni whom we follow. We humbly commit to serve humanity, caring for the sick, promoting good health, and alleviating pain and suffering. We will not permit considerations of race, religion, political affiliation, sexual orientation, gender identity, disability, nationality, or social standing to influence our duty to care. We solemnly pledge our commitment to this oath and our assistance to others who pledge the same. Congratulations, class of 2026.
This concludes our 27th annual White Coat Ceremony. Will the members of the audience please remain in their seats while the class of 2026 exits first, followed by the audience. Congratulations again.